If you have ever been punished for doing the right thing, this story is for you. And if it moves you even a little, hit like and subscribe before we begin. Because what happens to this nurse in the next 40 minutes will stay with you long after the video ends. Her name was Naomi Carter, and on the night everything changed. She was 31 years old. 7 years into a nursing career, she loved more than she had ever loved anything else in her life. She worked the night shift in the emergency department of Ridgeview Memorial Hospital, a mid-sized facility that served a working-class stretch of the city where ambulances came in steady waves after midnight. Car accidents, overdoses, gunshot wounds, heart attacks that had waited too long to be taken seriously. Naomi had chosen nights on purpose. She liked the quiet hours between the chaos, the way the hospital seemed to breathe differently after 2 a.m, when the administrators went home, and it was just the doctors, the nurses, and the patients who needed them most. She was good at her job. Not just competent, genuinely gifted in the way that some people are gifted at reading a room or reading a person. She could look at a patient's face and know, before the monitors confirmed it, that something was wrong. She had caught 2 silent heart attacks in her first 3 years, patients who had walked in complaining of nothing more than indigestion. She had talked down a combative patient in the grip of a psychotic episode without needing to call security. She had held the hand of a teenage boy who did not survive the night, and she had done it without letting him see her cry until she was alone in the supply closet afterward. The other nurses respected her. The younger ones asked her for advice. And for 6 of her 7 years at Ridgeview, she had never once been written up for anything more serious than a missed lunch break. Then Dr. Marcus Whitfield became the new attending physician in charge of the emergency department. He arrived with an impressive resume, fellowship at a prestigious teaching hospital, glowing recommendation letters, a reputation for efficiency that the hospital board loved and the nursing staff quietly dreaded. Marcus was in his early 40s, sharp-featured, always precise in his movements, the kind of doctor who measured his words before he spoke them and expected everyone around him to move at his pace or get out of his way. He believed deeply and sincerely in protocol. Protocol saved lives, he would say, and departures from protocol, however well-intentioned, introduced risk that could not be justified. It was not an unreasonable philosophy. In a chaotic emergency room, structure mattered. But Marcus applied it like a blade, without room for the judgment calls that experienced nurses like Naomi made every single shift. Judgment calls that were not violations of protocol so much as extensions of it. Born from years of watching protocol succeed and occasionally watching it fail a patient who needed something else. The night it happened, Ridgeview was short-staffed. 2 nurses had called in sick. A pile-up on the interstate had sent 6 trauma patients through the doors within 20 minutes of each other, and the department was running at a level of controlled chaos that only people who have worked in emergency medicine can fully understand. Naomi was assigned to triage, moving between patients, prioritizing based on severity, trying to keep the whole floor from tipping into disaster. Around 1:40 in the morning, a woman was wheeled in by her husband, pale, sweating, clutching her chest, insisting through gritted teeth that it was probably just her anxiety acting up again, that she didn't want to be a bother, that there were people who needed help more than she did. Naomi looked at her. Something in her gut, the same instinct that had caught 2 silent heart attacks before, told her this was not anxiety. The woman's lips had a faint bluish tinge. Her breathing was too shallow for someone merely panicking. According to protocol, chest pain patients without immediately obvious cardiac markers on initial assessment were to be triaged at a standard priority level and seen in order. And there were, at that exact moment, 4 patients ahead of her in the queue, 2 of them with visibly worse injuries from the highway accident. Protocol said wait. Naomi's instinct said now. She made the call herself. She pulled the woman out of the standard queue, wheeled her directly into an open bay, and began prepping her for an EKG without waiting for Marcus's sign-off. Because Marcus was elbow-deep in a trauma case and unreachable for at least another 10 minutes, and 10 minutes, Naomi believed, might be the difference between this woman going home to her husband and this woman not going home at all. She was right. The EKG showed a significant cardiac event in progress. Naomi's early intervention meant the cardiology team was activated almost 15 minutes sooner than they otherwise would have been. The woman survived, and by every account that mattered, the outcome, the patient's life, the family's gratitude, Naomi had done exactly what a good nurse is supposed to do. But Marcus did not see it that way, not at first. When he emerged from his trauma case and discovered that a nurse had unilaterally reordered his triage queue and begun an unauthorized diagnostic procedure without consulting the attending physician, his fury was immediate and, in his mind, entirely justified. He did not ask what had happened before he reacted. He saw only the violation, a nurse acting outside her authority, making decisions that were, in his view, his to make. Decisions that could have gone wrong in 100 different ways and exposed the hospital to liability. Decisions that undermined the very structure he believed existed to keep patients safe. In front of the charge nurse, in front of 2 residents, in the middle of a department still buzzing with the aftermath of a mass casualty influx, Marcus told Naomi that her actions were reckless, that she had overstepped, and that he could not in good conscience allow a nurse who disregarded protocol to remain on his floor. He suspended her on the spot, pending a formal review, and told her to go home. Naomi did not argue. She had learned over 7 years that arguing with a furious attending in front of a full department accomplished nothing except making things worse. She removed her badge, collected her things from her locker with hands that would not quite stop shaking, and walked out of Ridgeview Memorial into a parking lot lit by sodium lights and a sky just beginning to gray at the edges with the coming dawn. She sat in her car for 11 minutes before she trusted herself to drive. She did not cry, not yet. She simply sat, replaying the last 2 hours of her shift, trying to understand how doing the thing that saved a woman's life had ended with her badge in a manila envelope and her career hanging by a thread. Before she started the engine, she called her older brother Daniel, the only family she had close enough to call at that hour. He worked construction and kept farmer's hours, so she knew he would already be awake, drinking coffee before his crew arrived at a job site. She told him what had happened in flat, careful sentences, the way she had learned to report a code to a physician. Just the facts, no editorializing, because editorializing would have meant crying, and she was not ready to cry yet. Daniel listened without interrupting. When she finished, he asked her only one question. Did she believe she had done the right thing? She said yes, immediately, without hesitation. The only part of the whole ordeal she was certain of. Daniel told her that was the only thing that mattered right now. That titles and reviews and suspensions were things that happened to people, but the decision itself belonged to her, and no committee could take that back from her even if they took her badge. It was not much comfort, not really, but it was enough to get her car started and get her home, where she showered, lay down on top of her covers still in her robe, and stared at the ceiling until the sun came up fully, sleep never quite arriving. What Naomi did not know, could not have known, sitting in that parking lot, was that the story was not over. It was only beginning. At 3:52 that morning, the woman Naomi had pulled out of the standard queue coded. Her heart, weakened by the event Naomi's early EKG had caught, went into a dangerous arrhythmia during the cardiology team's stabilization efforts. It took 11 minutes to bring her back. 11 minutes during which every person in that room understood exactly how close they had come to losing her, and exactly how much closer they would have come if her cardiac event had gone undetected for even 15 more minutes past, when it actually had been. The cardiologist, a measured, unflappable woman named Dr. Patel, who had seen every kind of chaos medicine could produce, pulled Marcus aside once the patient had stabilized and asked him a single question. How had this patient come to her attention so quickly, given the state the department had been in that night? Marcus explained, still convinced he was explaining a failure, that a nurse had jumped the queue without authorization. Dr. Patel looked at him for a long moment. Then she said something that would stay with Marcus for the rest of the night, and arguably the rest of his career, that if this patient had waited the standard queue order, given how compromised her cardiac function already was by the time she reached the bay, there was a real chance she would not have survived to reach cardiology at all, that the nurse who broke protocol had not endangered the patient. She had saved her. Marcus stood in the hallway outside the cardiac unit for a long time after Dr. Patel walked away. He thought about the version of events he had built in his head in the heat of the moment. A reckless nurse, an unauthorized procedure, a violation that demanded consequences, and he began, slowly and uncomfortably, to see a different version. A nurse with 7 years of experience and an unblemished record had looked at a patient, trusted an instinct sharpened by thousands of hours at the bedside, and acted while he was unreachable, because waiting for him might have cost a life. He had not asked her why. He had not asked her what she had seen in that patient that made her act. He had reacted to the violation of his authority before he had ever considered the substance of her judgment. And in doing so, he had punished the very quality that had just saved a woman's life. He pulled the patient's full chart. He reviewed the timestamps meticulously: when the woman arrived, when Naomi flagged her, when the EKG was run, when cardiology was activated, when the code occurred. He built, almost against his own instinct for procedure, a timeline that made the truth undeniable. If Naomi had waited in the standard queue as protocol dictated, the delay would very plausibly have meant this woman's heart stopped somewhere between triage and treatment, unmonitored, unnoticed, until it was too late to bring her back. Marcus was not a man accustomed to being wrong, and he was even less accustomed to admitting it. But he was, underneath the sharp edges and the rigid adherence to structure, a doctor who had entered medicine because he wanted fundamentally to save people. And a doctor who wanted to save people could not stand in a hallway holding proof that he had punished the nurse who had done exactly that, and simply let it stand. He found Naomi's number in the staff directory. It was 6:14 in the morning. He knew rationally that calling a nurse he had just suspended less than 5 hours earlier, at an hour when most people were still asleep, was not a normal thing to do. He did it anyway. Naomi was awake. She had not slept. She was sitting at her small kitchen table with a cup of coffee that had gone cold an hour ago, staring at nothing, running through every possible outcome of the review that now hung over her career. Termination, a mark on her license, the end of 7 years she had built one difficult, exhausting, meaningful shift at a time. When her phone rang and she saw the hospital's number, her stomach dropped. She almost didn't answer. Then she did, because not knowing was worse than whatever was coming. Marcus's voice on the other end was not the voice she had heard in the department hours earlier. Clipped, certain, closed. It was quieter. It had the particular unsteadiness of a man saying something he had never had to say before. He told her about the code. He told her about Dr. Patel's question and his own answer, and the moment he had understood what that answer actually meant. He told her he had pulled the chart, reviewed the timeline, and that there was no version of events examined honestly in which her decision had been anything other than correct. Not just correct, but the single intervention that had given that patient a chance to survive the night. And then, in a voice that cracked slightly in a way Naomi would remember for a long time afterward, he told her he was sorry. Not the kind of sorry that comes wrapped in justification, the kind doctors and administrators offer when they are protecting themselves as much as apologizing. A plain, unadorned sorry, the kind that costs something to say. He asked her to come back. Naomi did not answer right away. She sat with the phone against her ear and let the silence stretch, because she needed him to understand that an apology, however sincere, did not erase what the last several hours had cost her. The humiliation in front of colleagues she respected, the terror of watching a career she had built with real sacrifice threatened by a decision she still believed, with total conviction, had been the right one. She told him, when she finally spoke, that she appreciated the call. She told him she needed to know that this would not happen again, that the next time her judgment and his protocol collided in the middle of a chaotic shift, he would ask her what she saw before he decided what she had done wrong. She told him that respect in that department could not run only one direction, from nurse to doctor, and that if she came back, it would have to run both ways from now on. Marcus agreed. Not quickly, not glibly, but with the same careful precision he brought to everything else. Because for a man like him, a promise made carefully was a promise he intended to keep. Before Naomi went back, she had one more conversation that mattered more to her than anything Marcus said on the phone. It was with Priya Anand, the charge nurse who had been standing beside her when Marcus suspended her in front of the department, and who had said nothing at the time, and not because she disagreed with Naomi, but because charge nurses learn early that arguing with an attending mid-crisis rarely helps the nurse being disciplined. Priya drove to Naomi's apartment the afternoon after the suspension with a bag of takeout neither of them touched, and sat with her at the same small kitchen table where the phone call had happened. Priya told her plainly that every nurse on that floor who had heard what happened already knew Naomi had made the right call, that the whispers moving through the break room were not questioning her judgment but questioning Marcus's, and that whatever the review decided on paper, She had already been vindicated in the only court that mattered to the people who worked beside her every night. It was, Naomi would say later, the conversation that made the decision to return possible at all, not Marcus's apology, sincere as it was, but the quiet certainty of the people who had watched her work for years and had never once doubted her. Naomi returned to Ridgeview Memorial 2 days later. Once the formal review, which now included Dr. Patel's account and Marcus's own revised statement, had cleared her completely and, in fact, resulted in a commendation being placed in her file rather than a reprimand. Walking back into that department was not simple. She felt the eyes of colleagues who had watched her get suspended and now watched her get reinstated, and she carried, for a while, a wariness toward Marcus that did not dissolve in a single phone call, however honest it had been. Trust, she had learned in 7 years of nursing, was not rebuilt with words. It was rebuilt with actions, repeated over time, until the pattern itself became the proof. And Marcus, to his credit, began building that pattern. In the weeks that followed, something in the department's culture shifted, quietly but unmistakably. Marcus started asking questions before he issued judgments. When a nurse deviated from a standard procedure, his first words became, "Walk me through what you saw," rather than, "Why did you do that?" He began holding brief debriefs after difficult shifts, not to assign blame, but to understand the reasoning behind the decisions his team had made under pressure, and more often than he expected. He found that reasoning was sound, sharper in fact, than the protocols that existed to standardize it. He did not abandon structure. He still believed, as he always had, that protocol saved lives on the whole, in the aggregate, across thousands of patients whose individual circumstances no rulebook could fully anticipate. But he came to understand something he had missed before, that the nurses who broke protocol rarely did so out of carelessness. They did so because they had spent years learning to see what protocol, by its nature, could not, the particular patient in front of them. The specific and unrepeatable configuration of symptoms and instinct and urgency that no flowchart could capture in advance. Naomi, for her part, did not become reckless with her newfound vindication. If anything, she became more careful, more deliberate, documenting her reasoning in real time whenever she made a judgment call that fell outside standard procedure, not because she distrusted her own instincts, but because she understood now that instinct alone, however sound, needed to be legible to the people around her if it was going to survive contact with a system built on accountability. She began, almost without meaning to, mentoring the newer nurses on the floor in exactly this: how to trust what your training and your gut were telling you, and how to make that trust visible enough that it could withstand scrutiny. 6 months after the night she was fired and rehired in the same 24-hour span, Naomi was asked to help design a new departmental protocol, one that formally built a pathway for nurses to escalate and act on urgent clinical judgment, even when the attending physician was unreachable, provided the reasoning was documented and reviewed afterward. It was, in a very real sense, an institutional version of the trust Marcus had promised her over the phone that morning, a system that no longer forced nurses to choose between waiting for permission and doing what they believed, with good reason, needed to be done. Naomi worked on that protocol with Dr. Patel and eventually with Marcus himself, the three of them sitting in a conference room going line by line through scenarios that had once ended in suspension and now ended in something closer to partnership. The patient herself, whose name was Rosalind Ferreira, came back to Ridgeview 3 weeks after her discharge, not for treatment, but simply to find Naomi. She waited in the lobby until the end of a shift change, holding a small potted plant she had bought at a grocery store because she had not known what else to bring someone who had, in the most literal sense, kept her alive. She told Naomi she had heard through a friend who worked in hospital administration some garbled version of what had happened that night, that the nurse who treated her had gotten in trouble for it. She wanted Naomi to know that her husband and her 2 grown children knew the story too, and that all of them agreed on one point without any disagreement at all. Whatever rule had almost cost Naomi her job was a rule that should never have existed in the first place. Naomi kept that plant on the windowsill of the nurses' station for years, watering it between shifts, and when new staff asked about it, she told them it belonged to a woman who had taught her, more than any policy manual ever could, exactly why the work mattered. Marcus never forgot the sound of his own voice on that phone call at 6:14 in the morning, the crack in it when he said he was sorry. He kept tucked in the top drawer of his desk a printed copy of the patient's cardiac timeline, the one that had shown him, in cold clinical numbers, exactly how close a woman had come to dying because he had reacted to a violation of his authority before he had understood the reason behind it. It was not a trophy. It was a reminder, one he needed on the harder days when his instinct for control rose up again, as it sometimes still did, because old patterns do not vanish simply because a person has learned, once dramatically, that they were wrong. He looked at that timeline and remembered that the department did not exist to prove him right. It existed to keep people alive, and sometimes the people best positioned to do that were not the ones with the most authority, but the ones with the sharpest eyes and the courage to act on what they saw. Naomi stayed at Ridgeview Memorial for years afterward, eventually becoming the charge nurse of the department that had once suspended her in front of her peers. She trained dozens of new nurses over that time, and to every one of them, at some point in their first difficult shift, she told the story, not as a grievance, but as a lesson. She told them that being right does not always protect you in the moment, that doing the correct thing can sometimes cost you before it vindicates you, and that the measure of a workplace worth staying in is not whether it gets things right the first time, but whether it is capable of admitting when it gets things wrong and changing because of it. She told them that the woman whose heart had nearly stopped that night went on to attend her daughter's wedding 2 years later, healthy, present, alive, and that every time Naomi thought about handing in her badge that night, she thought about that wedding and knew, without any doubt at all, that she would make the same call again. And Marcus, when new residents rotated through his department and asked him, as they inevitably did, what kind of doctor he tried to be, no longer answered with the word efficient, or the word precise, though he still valued both. He answered instead that the best thing a doctor in charge of a department could learn to do was listen before he judged, because somewhere on his floor, on any given night, there was a nurse whose instincts were sharper than his own certainty, and the only real question was whether he would be humble enough, in the moment that mattered, to find out.